Hey everyone, welcome back to my channel. I'm Clifford Berger and I provide life and style perspectives for men in midlife. And you can find my blog and my website at cliffordberger.com. In my last video, I talked about what it is like to break off a tooth because about a week and a half ago that actually happened to me. I broke off this uh, eye tooth here, the one that dentists call number 10, um, broke it off eating a dried almond. And that very day, I made a video about what the experience was like at that point. And it was a little bit traumatic, just all of a sudden finding my tooth in my mouth. So that short video was about in the immediate aftermath of having broken it off. And at that point, I hadn't seen the dentist or anything yet. So I'd like to follow up with a part two on that. This video will be what has happened and what has transpired with my tooth since then. So the very next day, I was able to get into my regular dentist the next morning, and she looked at it and quickly determined that I had two options. One would be a bridge, and the other would be an implant. And I learned that a bridge is kind of where they put a fake tooth in by attaching it to the two teeth on either side. That's kind of an older school way of doing it, and the other, and it also can end up compromising the teeth on either side ultimately, and they didn't really want to do that. So the better option was to do an implant, which is where they basically put a um, like a a grommet inside of your skull bone, and then after that are able to screw a permanent crown, permanent fake tooth into that. Well, that sounds simple, but it turns out to be a rather involved process. So my dentist referred me to an oral surgeon whom I was able to see that very afternoon. So that was on a Friday afternoon, and I went in and had my initial consultation, and they did all the examination and told me what would be involved in that, what the cost would be, which is significant even with dental insurance that I have. But I needed to proceed with that, and thankfully they were able to get the procedure scheduled for the very next Monday morning. So I went back on that Monday morning for the actual implant procedure, which is considered an oral surgical operation. And I elected not to be put to sleep during it. You can either be put to sleep, and then they would also numb you, but you wouldn't know what's going on, or they can just numb you with shots, which is what I decided to do. I've had most of my dental work done that way. Once I was in the room ready to have it done, I started to question that decision a little bit, wondering if maybe I should have just allowed them to put me out for it. But by then it was too late because I'd already eaten some breakfast. So on with just the numbing. And so they proceeded with that. And as you might expect, it was quite a bit of drilling and pulling and hammering on this thing because first they had to extract the root of the old tooth, what remained of it. And again, it was a dead root, but still that had to come out. And then they had to drill a place for the implant to be. And I kind of liken it to, when you put one of those wall grommets in a wall board, so that you can put screws into the wall to hang things on. It's something like that. They install a implant device up into your jawbone, in this case into my upper bone, and then that actually has to set for a period of 4 months. See, this is this is not a one and done procedure. It's Another illustration I would use is it's sort of like creating a planting a fence post in a concrete base where you dig the hole, you put the concrete in, and ultimately you put the fence post in the um, in the concrete, but it has to set up to accommodate that post and for it to be stable. They can't just put the permanent crown on there right away. So for any of you who have had this done before, you know what I'm talking about. But if you've never had an implant, what I'm describing here is what you can expect to face. Um, by the time you get to my age, it probably is fairly common to have that done, or at least not uncommon, because I'm almost 65 years old. When you think about the fact that my teeth are same age as the rest of me, it's a wonder that they last as long as they do, given the kind of wear and tear we put on them and just the years of service that our teeth are expected to provide. So do take good care of your teeth. I do, but in any case, this happened. So um, what they don't want to do is disturb that implant while it is in the setting process, because your jawbone actually has to assimilate around that, and the blood capillaries and so on integrate with the implant so that it becomes part of the bone. All right. During that 4 month period, they really don't want to disturb it. And in the process of this, I learned that if I were to have a temporary crown put in, have it would look better because I wouldn't have this gap in my mouth, which doesn't really show too bad when I'm just talking normally, unless I smile really big or pull my lip open. Most people have said that they don't even know that it's there. But the real concern was that if I had the implant or the fake crown, the temporary crown, I should say, all crowns are fake, the temporary crown put in, that I wouldn't be able to bite down on anything for 4 months. I'd have to eat softer food for that period of time. I'd just have to be really careful about bumping it with anything else, even a piece of silverware, something like that, lest it disturb the uh, the implant. It's sort of like if you were to shake the fence post while it's still in the softer concrete, then it's not going to be a stable fence post setting. Versus if you just had, say, a bracket in the concrete waiting for a fence post to be installed later, a bracket would be more stable. So I decided not to have the temporary crown put in, but to just leave it open like this and to have the implant part put in. Well, that did take about 45 minutes or so of drilling and pulling and all of that. And they actually had to cut back some of the gum and make way for their procedure. And so when they were done, it required stitches or sutures to close that up. And by that point, I was ready for the process to be over, but it wasn't as bad as what I thought it might be. When you're in the dentist chair, your just thoughts go elsewhere and just kind of deal with what's happening and wait for it to be over. And once it was over, then I was given post operative instructions, antibiotics to take because they don't want me to get an infection where this is. The special mouth rinse, that's also kind of an antibiotic rinse that I'll take for like 2 weeks. I'm nearly a week into this already. And then I need to go back in another week. It'll be 2 weeks after the original procedure to have the oral surgeon remove the sutures and make sure that everything is stable and ready for just the ongoing healing and setting of the implant. So in another little bit more than a week, I'll be doing that. And then it's just a matter of waiting weeks and several months. It will be well into August before this will be resolved, at which point I will go back to my regular dentist who will prepare a, a permanent crown to be, I guess, kind of screwed onto uh, the post of the implant, is how I'm imagining this. It may not be exactly like this, but the result, the oral surgeon said, would be that that would be probably the strongest and most stable tooth in my head. The rest of my teeth are rooted in pretty well. They're very happy with how those are, but this one would be even better as it's screwed directly into the skull bone. And at that point, then I'd be back to normal with a brand new tooth. So I'll probably do an update come August when that happens. But for the time being, this is my second update for you on what it is like and what you might expect if this ever happens to you. The cost is significant. I could probably buy a used car for what this is costing, although dental insurance is taking a significant chunk out of that. I could still probably buy a used car with the part that I have to pay, just one that's not as good. And anyway, at this point, it's just a matter of still being careful with this spot, even if I don't have a temporary crown in. I still have to be careful with it and um, not disturb the location. So this is what I'll be dealing with for coming months. I probably won't be smiling big for photos, just a pleasant closed mouth smile, and that will be it. So, hope this has been interesting and maybe somewhat informative to you if you ever face this procedure, and I'll keep you updated if there are any changes. So, thanks for listening, and I'll see you in the next one.